Hello and welcome back to Neo-Psychology with me, your teacher, Mr. Neo, the channel where I teach online psychology lessons to my lovely students. Today we're looking at therapies. We're moving on from explanations and we're moving on to therapies now. Therapies for schizophrenia. This is the schizophrenia unit and we're starting with lesson 8, biological therapies, specifically drug therapy. Let's get started. Starter. According to the biological approach that we learned about in the first year from the approaches, what would be the best way of treating schizophrenia? What therapy would a biopsychologist promote? Right? Don't strain your head though, it's in the title, right? Drug therapies, right? A biopsychologist would promote drugs, they would promote medicine, okay? Let's have a look. So number 1, learning objective 1, show comprehension and apply knowledge of typical antipsychotics, and then learning objective 2, and identify and analyze atypical antipsychotics. Oh, we got two things here, typical and atypical antipsychotics. Let's find out about them, shall we? You pumped? Me too. Right. Biological therapies for schizophrenia, drug therapy. Prior to the introduction of antipsychotic drugs in the 1950s, there was no effective treatment for schizophrenia. Until this time, the standard treatment for schizophrenia consisted of providing patients with a safe and supportive environment in the form of a long-stay psychiatric hospital and hoping for some improvement in schizophrenia in symptoms. Literally, there was no medication, nothing, right? And as medication is essential with something as severe as a mental disorder as schizophrenia, right? Literally, just giving them a hospital and putting them there and just hoping they'll get better is literally the best solution they had. Essentially, isolating them from the rest of society. Awful, awful times. However, following the discovery of dopamine in 1952, drugs were developed that had a direct effect on the action of this neurotransmitter, right? As we learned from the dopamine hypothesis, dopamine plays some sort of role in schizophrenia or schizophrenic symptoms. Some drugs, such as amphetamines, were found to create the symptoms of schizophrenia in healthy people. So people that take amphetamines, like horse tranquilizers, like ketamine, found that they develop temporary positive symptoms of schizophrenia like hallucinations and delusions because they increase the dopamine, while others remarkably reduce these symptoms in people who are severely ill if they reduce the symptoms of dopamine. Drugs that had the latter effect consequently became known as antipsychotics and were used in drug therapy. So all antipsychotics reduce the levels of dopamine in the patient because we found that there's some sort of link with dopamine and schizophrenic symptoms like hallucinations and delusions. The most common treatment for schizophrenia involves the use of antipsychotic drugs. Antipsychotics can be taken as tablets or in the form of syrup. For those particularly at risk of failing to take their medication regularly, some antipsychotics are available as injections given every 2 to 4 weeks. Now it's interesting because injections would be good to give because people with schizophrenia, they have a tendency to sometimes forget to take their medication because they've got other engagements going on in their mind, other things that they're worrying about. So sometimes it's good because they are likely to forget their medication. However, if you're someone with schizophrenia and you're suffering from delusions of persecution and people trying to kill you, being willing to have someone inject something into you isn't likely to happen. So the most common medication that people take with schizophrenia, the most common antipsychotics, is usually through tablets. You know, here's your daily dose of tablets, take those. Daily or weekly, I don't know, it depends on the drug. Antipsychotics may be required in the short or long term. Some patients can take a short course of antipsychotics, then stop their use without the return of symptoms. That's going to be people with very mild schizophrenia. Other patients, or the majority of patients, may require antipsychotics for life or face the likelihood of a reoccurrence of schizophrenia. Right, those people with schizophrenia typically have to be on medication for the rest of their life. You cannot you're never resolved of schizophrenia. You will always have it, but you can usually manage it with medication and other therapies to reduce the symptoms to live a perfectly normal life. Antipsychotics can be divided into typical, which is traditional, and newer atypical or second generation drugs. Okay, so typical and atypical, typical being the traditional drugs and atypical being the second generation, the newer drugs. And that's what we're looking at today. This lesson is concerned with antipsychotic medication. This is the most commonly used treatment for schizophrenia. Antipsychotics can be split into older typical antipsychotics and newer atypical antipsychotics. So there we go. Biological therapies for schizophrenia. There's only one type of therapy from the biological perspective, that's drug therapy. And within drug therapy, we have typical and atypical antipsychotics. Let's start with typical. Typical antipsychotics. These have been around since the 1950s and include chlorpromazine. Chlorpromazine can be taken as tablets, syrup, or by injection. If taken orally, it is administered daily, up to a maximum dose of 1,000 milligrams, although initially doses are much smaller, and for most patients the dosage is gradually increased to a maximum of 400 to 800 milligrams. Typically prescribed doses have declined over the last 50 years. There is a strong association between the use of typical antipsychotics like chlorpromazine and the dopamine hypothesis. Typical antipsychotics like chlorpromazine work by acting as antagonists in the dopamine system. Antagonists are chemicals which reduce the action of the neurotransmitter. So dopamine antagonists work by blocking dopamine receptors in the synapse of the brain, reducing the action of dopamine. So the synapse is the connection between two different neurons. Okay, so it's the axon ending or the axon terminal of one and the dendrite of another. And in our brain, we've got millions of billions of neurons all connected in our head together. And the connection is called the synapse. And what this antipsychotic medication does, it blocks the transmission of dopamine. These are dopamine antagonists. Okay, they block the dopamine receptors in the synapse, so the connections aren't being sent across. So dopamine antagonists work by blocking dopamine receptors in the synapse of the brain, reducing the action of dopamine. Initially, when a patient begins taking chlorpromazine, dopamine levels build up, but then its production is reduced. According to the dopamine hypothesis of schizophrenia, this dopamine antagonist effect normalizes neurotransmission in key areas of the brain, reducing symptoms like schizophrenia. Okay, this medication that reduces the dopamine has found to reduce symptoms of schizophrenia, or specifically hallucinations. As well as having antipsychotic properties, chlorpromazine is also an effective sedative. So a sedative is something that promotes calm or inducing sleep. This is believed to be related to its effect on histamine receptors, but it is not fully understood how this leads to sedation. Chlorpromazine is used to calm patients not only with schizophrenia but also with other conditions. This has often been done when patients are first admitted to hospital and are very anxious. Okay? Same way if we were admitted into a new hospital, a new place that we were going to live in, we would be quite anxious. Some people with schizophrenia would be particularly anxious because it's going to be a completely new setting, it's something they're unfamiliar with, accompanied with their hallucinations and delusions and potentially ideas of persecution. Then it's going to be really difficult. Syrup is absorbed faster than tablets, so it tends to be used when chlorpromazine is used for its sedative properties. Okay, so if they wanted to calm someone down, promote calm or induce sleep, then sometimes this is what they would administer. Okay, so typical antipsychotics. Get the definition down, please. Typical antipsychotics is the first generation of antipsychotic drugs, having been used since the if I remember correctly, it was 50s. Yes, the 1950s. They work as dopamine antagonists and include chlorpromazine. Okay, give an example. There we go. So typical antipsychotics, they're the first generation of antipsychotic drugs, having been used since the 1950s. They worked as dopamine antagonists when we discovered that there's some sort of association or link between schizophrenic symptoms and dopamine. We go, right, let's make this medication that reduces the dopamine. Okay, cool, brilliant, it's worked, or it works to a certain degree. And it includes the medication chlorpromazine. Okay, application question. Question antipsychotics, right? We're talking about Cali here. In your answer, talk about Cali. Don't talk generically. Talk about Cali specifically and just quote parts of the question and back in the answer. You are a mental health professional and have a family friend of Cali. Cali has been prescribed antipsychotics, but is refusing to take them because she has heard that they have serious side effects and that they do not work. Question. Cali's family asks for your advice. What might you tell them about Cali's concerns? Right? Talk to Cali's family. What would you say? Right. It is important not to undermine anyone's treatment by criticizing their doctor's choice of treatment approach. I would tell Cali that antipsychotics are the standard treatment for schizophrenia and that they are moderately effective, although how much they help varies from one patient to another. I would also advise her that although side effects can occur, it is usually possible to stop them by changing dose, changing antipsychotic medication, or by giving additional medication. I might mention alternative psychological treatments as well, which we will have a look at in later lessons. That's typical antipsychotics, right? It's the first wave, the first generation of psychotic medication. Identify one thing you learned about typical antipsychotics. Why do you think learning about antipsychotics is important? I think it gives us a better understanding of the people with schizophrenia. You know, essentially we found that there's a link between dopamine and someone went, right, well, let's make some medication that reduces the dopamine. Let's see if that helps. Yeah, look, it's reduced some of the symptoms. Brilliant, it works well. How does typical antipsychotics apply in real life? It's used with people, you know. There will be people with mental health problems that take antipsychotic medication. And what questions has typical antipsychotics raised for you? What are you still wondering about? You got any questions? Let me know. Talk to me. Put it in an email, write them down, put them in the comment section. Either way, I'll try and get back to you. That's learning objective 1. Show comprehension and apply knowledge of typical antipsychotics. Tick. I'm ticking it off, regardless if you're happy or not. We're moving on to atypical antipsychotics now. Atypical. Let's crack on, shall we? Right. Let's have a look at atypical antipsychotics. So, the typical antipsychotics had been used from the 1950s onwards. Atypical antipsychotics have been used since the 1970s. The aim in developing newer antipsychotics was to maintain or improve upon the effectiveness of drugs in suppressing the symptoms of psychosis and minimizing the side effects. Okay, so they created these new drugs, this new wave of antipsychotics, and the reason is to find hopefully some that are more effective and have smaller side effects. Okay, perfect. That's exactly what we want. There are a range of atypical antipsychotics and they do not all work in the same way. In fact, we do not know how some of them work. Okay, let's have a look at some of these atypical antipsychotics. Clozapine. Clozapine was developed in the 1960s and first trialed in the early 1970s. It was withdrawn for a while in the 1970s following the deaths of some patients from a blood condition called agranulocytosis. Yeah, we're going with that one. So one of the side effects of clozapine is death. However, in the 1980s, when it was discovered to be more effective than typical antipsychotics, clozapine was remarketed as a treatment for schizophrenia to be used when other treatments fail. It is still used in this way today, and people taking it have regular blood tests to ensure they are not developing agranulocytosis, or the blood disorder. Because of its potentially fatal side effects, clozapine is not available as an injection. Daily dosage is a little lower than for clozapine, typically 300 milligrams to 450 milligrams a day. So there we go. Clozapine is found to be really effective, but only used when it's absolutely necessary because it has got one side effect of a blood condition called granulocytosis, which can cause death. Clozapine binds to dopamine receptors in the same way that chlorpromazine does, but in addition it acts on serotonin and glutamate receptors as well. It is believed that this action helps improve mood and reduce depression and anxiety in patients, and that it may improve cognitive functioning. So this is really good then. Clozapine is really good because it improves mood and reduces depression and anxiety, which is usually comes hand in hand with schizophrenia a lot of the time, as we saw with the comorbidity. The mood-enhancing effects of clozapine means that it is sometimes prescribed when a patient is considered at high risk of suicide. This is important as 30 to 50% of people suffering from schizophrenia attempt suicide at some point. That's a massive, massive percentage. 30 to 50% of people suffering with schizophrenia attempt suicide at some point. So it's important, it's absolutely fundamental to try and improve their mood and reduce depression. Okay, risperidone. Risperidone is a more recently developed atypical antipsychotic, having been around since the 1990s. It was developed in an attempt to produce a drug as effective as clozapine, but without its serious side effects of death. Like chlorpromazine, risperidone can be taken in the form of tablets, syrup, or an injection that lasts around 2 weeks. In common with other antipsychotics, a small dose is initially given, but this is built up to a daily dosage of 4 to 8 milligrams and a maximum of 12 milligrams. Risperidone, like clozapine, risperidone is believed to bind to dopamine and serotonin receptors. Risperidone binds more strongly to dopamine receptors than clozapine and is therefore effective in much smaller dosage than most antipsychotics. You can see it was a really small dosage, 4 to 8 milligrams is really small. And is therefore effective in much smaller doses than most antipsychotics. There is some evidence to suggest that this leads to fewer side effects than in typical antipsychotics. Okay, what is atypical antipsychotics? Drugs for schizophrenia, a psychotic disorder developed after typical antipsychotics. They typically target a range of neurotransmitters such as dopamine and serotonin. Examples include clozapine and risperidone. Right, another application question. Explaining it to Brendan. Talk about Brendan. What's our B-man doing? Right, Brendan has recently been diagnosed with schizophrenia with accompanying depression and suicidal thoughts. Poor Brendan. Brendan is a scientist and is curious about how antipsychotics work. He is also curious about his psychiatrist's choice of clozapine as his antipsychotic. Right. Number 1, explain how Brendan's psychiatrist might explain the effects of antipsychotics. Refer to the dopamine hypothesis in your answer. Okay, we'll talk about how it's related to dopamine and how it lowers levels of dopamine, which has shown to lower the symptoms of schizophrenia or reduce symptoms. And then extension, why might Brendan's psychiatrist have prescribed clozapine? Why clozapine? Give your answer, please. Explain it to Brendan. He needs to know. Write it down. Give your answer. Give yourself 5 minutes. And I'm going to go through the answer now. Pause the video if you want to have a go on your own, please. Here we go. Brendan's psychiatrist will explain that antipsychotic drugs are dopamine antagonists and that they work by binding to dopamine receptors, leading to a reduction in dopamine production. This reduction in dopamine production leads to a decline in the symptoms of schizophrenia. Why might Brendan's psychiatrist have prescribed clozapine? Well, one reason Brendan's psychiatrist might have chosen clozapine is that Brendan, quote, Brendan is suffering depression and is at risk of suicide. Clozapine acts on serotonin and glutamate receptors as well as dopamine, helping relieve depression. It improves mood. One reason why he may have chose clozapine is because it improves mood and he's a potential risk of suicide. And that's atypical antipsychotic. We had a look at typical and we had a look at atypical antipsychotics. There we go, on to the plenary already. How about that? Smashing it for time. Watch this video on schizophrenia treatment options. Alright, so it's a video on treatment. I think it's actually a video for people with schizophrenia, and it sort of explains what's going on. It explains why you're taking medication and what the medication does and how it might affect you. Okay, and there we go. That was today's lesson. Thank you for taking part in today's lesson. That was lesson 8, biological therapies, drug therapy specifically. Well done, my neuropsychologist. Great job today. Next lesson is lesson 9, biological therapies, drug therapy, evaluation. Be good, stay safe, God bless, and peace.
I'm feeling like Will, I feel like a prince, I'm feeling myself. I'm loaded with bills, cause I wasn't blessed with no Uncle Phil. Don't know how it feels, I wanted to flex, they told me to chill. I'm making a flip, my life is a flick, now load up the film.